Hello everyone, today we will be presenting on prebiotics and probiotics in dentistry. Prebiotics and probiotics are emerging tools that help support oral health by maintaining a healthy balance of bacteria in the mouth. Instead of eliminating all bacteria, these approaches focus on promoting beneficial bacteria and reducing harmful ones. In this presentation, we will explain what prebiotics and probiotics are, how they work, their role in preventing caries, periodontal disease, and halitosis, as well as their clinical application, safety considerations, and future implications in dentistry. Prebiotics are substances that act as food for good bacteria in the mouth. They do not contain bacteria themselves, but they help good bacteria grow and become stronger. When good bacteria grows, they help protect the teeth and gum from damage. Prebiotics also help reduce acid in the mouth, which lowers the risk of cavities. By helping good bacteria grow, prebiotics help maintain a healthy balance and protect oral health. Probiotics are live microorganisms that provide health benefits when used in adequate amounts. Common probiotic strains include Lactobacillus and Bifidobacterium. These beneficial bacteria support oral health by adhering to oral tissues and competing with harmful bacteria for attachment sites. They also produce antimicrobial substances such as bacteriocins and hydrogen peroxide, which inhibit pathogenic bacteria like Streptococcus mutans. In addition, probiotics help regulate the immune response and reduce inflammation in gingival tissues. Overall, probiotics help maintain balance in the oral microbiome and support oral health by reducing harmful bacteria and promoting beneficial ones. The oral cavity contains over 700 species of microorganisms that form dental biofilm. In a healthy state, there is a balance between beneficial and harmful bacteria. However, environmental changes such as poor oral hygiene or diet can cause dysbiosis, which is an imbalance in the microbiome. Dysbiosis is associated with dental caries and periodontal disease. Traditional dental therapy focuses on removing plaque and bacteria through mechanical and antimicrobial methods. However, newer approaches focus on managing the biofilm ecosystem by promoting beneficial bacteria rather than eliminating all bacteria. Prebiotics and probiotics support this ecological balance and help prevent disease. Prebiotics and probiotics work together to support oral microbial balance. They help shift the oral environment from dysbiosis, which is disease associated, to symbiosis, which is a healthier, balanced state. Prebiotics aid in caries prevention by reducing acid producing bacteria and promoting beneficial bacteria. They also support periodontal health by reducing inflammation and harmful biofilm. In addition, prebiotics may help reduce halitosis by limiting bacteria that produce volatile sulfur compounds responsible for bad breath. Overall, prebiotics help create a healthier oral environment by supporting beneficial bacteria. Prebiotics and probiotics work through different but complementary mechanisms. Probiotics directly compete with harmful bacteria for adhesion sites and produce antimicrobial substances that reduce pathogenic bacteria. Prebiotics work by feeding beneficial bacteria, which increases ammonia production and raises pH plaque. This helps neutralize acid and reduce demineralization. Beneficial bacteria such as Streptococcus sanguinis and Streptococcus salivarius help maintain a neutral oral environment. As a result, the oral microbiome shifts towards a healthier balance, reducing inflammation and disease risk. Probiotics help prevent dental caries through several mechanisms. First, they compete with cariogenic bacteria like Streptococcus mutans for adhesion sites, reducing harmful biofilm formation. Second, they produce antimicrobial substances such as bacteriocins and hydrogen peroxide, which inhibit harmful bacteria. Third, probiotics help stabilize the biofilm environment and reduce acid production. This results in fewer demineralization episodes and support enamel health. Overall, probiotics can contribute to caries prevention by promoting a healthier oral microbiome. Probiotics may also support periodontal health. They help reduce inflammation, decrease bleeding on probing, and may also reduce pocket depth when used in addition to periodontal therapy. Probiotics work by regulating the microbial population and suppressing harmful pathogens. They also produce antimicrobial substances that help produce host tissues. However, current research is still limited and more studies are needed to confirm their long-term effectiveness. Probiotics should be used as a supplement to traditional periodontal therapy, not as a replacement. Halitosis or chronic bad breath is primarily caused by bacteria that produce volatile sulfur compounds. Prebiotics can help reduce halitosis by feeding beneficial bacteria and shifting the oral microbiome away from odor-producing bacteria. This reduces the production of volatile sulfur compounds over time. Prebiotics may also be preferred for some patients because they do not introduce live bacteria. However, prebiotics should always be used alongside proper oral hygiene practices such as brushing, flossing, and tongue cleaning. Prebiotics and probiotics are available in many forms for patient use. Probiotics can be found in lozenges, chewable tablets, chewing gum, mouth rinses, toothpaste, gels, or oral sprays. Lozenges and gum are especially effective because they provide longer contact time in the oral cavity. Prebiotics are available in toothpaste, mouth rinses, lozenges, gum, sprays, and dietary supplements. These delivery methods allow patients to easily incorporate prebiotics and probiotics into their daily oral hygiene routine. While prebiotics and probiotics offer benefits, there are important safety considerations. Medically compromised or immunocompromised patients should consult a healthcare provider before using probiotics because they contain live bacteria. Prebiotics may be safer for these individuals since they do not introduce live organisms. Additionally, prebiotics and probiotics should only be used as an addition to oral hygiene, not as a replacement. Their effects may be temporary and benefits may decrease if use is discontinued. It is important to first control active disease and maintain good oral hygiene for optimum effectiveness. When educating patients, it is important to explain that prebiotics and probiotics help support a healthier balance of the oral bacteria. Patients should understand that results are gradual and require consistent use. These products should always be used alongside brushing, flossing, fluoride use, and professional dental care. Patients should also choose products with a clear strain information and realistic claims. Medically compromised patients should consult their healthcare provider before using probiotics products. Prebiotics and probiotics represent an important shift in dentistry towards personalized care. In the future, salivary testing may help identify a patient's specific risk factors and guide probiotics or prebiotic recommendations. Dentistry is shifting from eliminating all bacteria to supporting a healthier balance of oral bacteria. New delivery methods such as slow-release strips, gels, and varnishes may improve effectiveness by increasing contact time. These innovations may help improve prevention and treatment of caries, periodontal disease, and other oral conditions. In conclusion, prebiotics and probiotics are promising tools for supporting oral health. Probiotics help by competing with harmful bacteria, producing antimicrobial substances, and reducing inflammation. Prebiotics help by feeding beneficial bacteria and improving the oral environment. Together, they help shift the oral microbiome from dysbiosis to a healthier, balanced state. However, they should always be used in addition to oral hygiene and professional dental care. With continued research and advancements, prebiotics and probiotics may play an important role in the future of preventative dentistry. Thank you for listening to our presentation. We hope this helped you understand the role of prebiotics and probiotics in oral health.